All right. Well, again, good morning. And thank you for joining me this morning, this bright and early, what is it, Thursday morning?
Thursday morning.
Tell us your name and what do you do?
My name is Dr. Jeff Hutchinson. I'm an adolescent medicine physician. It means I take care of young people ages 11 to 25.
I did the wrong one, video and not audio. So if you were describing to an 8-year-old, what do you do? How would you describe?
Sure. I actually grew up or started my career seeing 8-year-olds. I started as a pediatrician, so I'm very used to talking to 8-year-olds. I would tell them that I help young people manage their health, to take care of them if they have sports injuries, to help them with some of the stresses in life. And I take care of a lot of acne and other issues that have to do with growing and developing.
Again, and where are you? Where do you work? Are you
I work at People's Community Clinic in Austin.
okay? And where is that?
It is right in the triangle between 183, 290, and 35.
And did you always know you wanted to be a doctor?
I actually did. My my origin story starts back in fourth grade. I grew up in Los Angeles. I went to almost all Black Catholic elementary school. And one day a substitute teacher came in, and we as kids, acting like we normally do, were giving them a hard time. And she yelled to the class, essentially, "Shut up, none of you are going to be anything." And I remember thinking at that time, "Oh, yes, I will. I'm going to be a veterinarian." So I wanted to be a veterinarian from the beginning. But in high school, when I was teaching Sunday school, I thought I'd rather take care of people's kids instead of their pets.
That's a difference. Well, the next question is, where were you born and raised? So tell us about growing up in LA. That's what Hollywood, right? That's what we think of.
LA is fortunately more than just Hollywood. But I started in central LA, so not quite South Central, but in the middle of the city. My dad is a retired LAPD officer. So my impression of police and impression of LA was, I think, very different than a lot of other people. My brother unfortunately died when I was young, and we soon moved to a west part of LA called Ladera. If you know anything about the segregation in Los Angeles, you know that there were Black areas and Hispanic areas, and Ladera was known close to Baldwin Hills, like the Black Beverly Hills. So we weren't far from that. It was our way of moving on up. LA was a good place to grow up, a lot of experiences.
When did you come to Austin?
I retired from the military in 2018. I spent 25 years going around the country, around the world, serving in the Army. And in 2018, when I retired, we came to Austin because my wife went to UT and thought Austin would be a good place to land.
Similar story. I think I forgot that you had. Oh, you know what? I think I saw your photo in your dress blues. There's two other top 10s who were military. One's a lawyer, one's a doctor. Oh, actually, one's a lawyer. No. Yeah, and DeVry. Do you know DeVry Anderson?
He went to West Point. I didn't know him at West Point. I think we were like 3 years apart.
Okay. Yeah, I think he's a little younger than I am. So describe what it's like being a Black male doctor in the US.
Absolutely. Being a Black male doctor, especially a pediatrician, is unique. Most everyone assumes that I'm not a doctor. I've had comments from people when they find out that I am, saying how unusual, to the look of surprise that I am a doctor. Even in the hospital, when wearing a white coat, we have a lot of respiratory therapists and other people who work in the hospital who are Black, who are not doctors. And almost always the first assumption is that I am not the doctor. I'm really fortunate to have been in the military system because along with the signaling of a white coat, I had the signaling of a uniform. And my uniform had my rank on it. And so people, they could see that I'm an officer wearing a white coat. So they think, well, maybe I am a doctor. And that bought me some privilege. Now, one of the ranks that we have in the military is called Lieutenant Colonel, and it's a black oak leaf in our uniform. And it looks an awful lot like the specialist's insignia. So the 6 years I was at rank, I was assumed to be a specialist much more often than an officer. And if you know anything about the military, specialists are usually early career and non-commissioned officers. So young people in their 20s and maybe up to their 30s. And I was easily in my late 30s. So it was an assumption based truly on my color and where I was, that my rank was not a lieutenant colonel, not an officer, but enlisted.
Yeah, I retired as a lieutenant colonel as well in the military. So yeah, I
Experienced that too.
I get it. I get it. Yeah. Oh yeah. Yeah. And it's, sometimes it's funny and sometimes it's not,
Right.
The
salute, right?
Yeah,
when
exactly.
It gets to you.
Oh yeah. 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 And they look at you and then they're like, oh, excuse me, So yeah. Yeah. Well, I got called a male all the time, because they just weren't used to seeing a woman officer. So I got used to that. How do you give back?
Give back to the community? That's a fantastic question. So I think since the beginning, I mentioned about teaching Sunday school. That was when my heart for service really began, because helping young people to learn and to move forward, it really gives me life. It gives me energy. So being in this profession, I get the real satisfaction when I get that light of understanding and believing that they can do something in the patients that I see. So individually, of course, I give back, give each patient my full attention, and I'm there, I'm present for them. And sometimes all I can do is listen. But most of the time I have a little insight and knowledge that helps them move forward. That's on the individual level. On the larger scale, I noticed that there aren't very many Black doctors. And I think many people have noticed that. In fact, when patients show up and see me, when Black patients show up and see me, they have such a big smile of having a Black doctor that it also reminds me how important it is that I do what I do. So I also have the intention to help as many people become doctors as possible. Before coming to Austin, I was an associate dean at a medical school. And one of my roles was in recruiting people to come into medical school. And I did everything I could to increase the number of Black physicians. So help people come in the direction that you've been is the model that I live by. I really believe in giving back because I've been given so much.
Awesome. Awesome. What would you tell what advice would you give your younger self?
How young am I going to go? Because the advice changes depending on what age, of course. So in high school, most people, and I include myself, are really just focused on high school, learning and enjoying. And that is really what high school is about. You find out what you're good at and you build those skills and keep going. In college, again, going to West Point, there were some things that I wish I knew beforehand. I wish I had mentors I could ask questions to. So I would tell my college age self to find someone who you can be vulnerable with and actually ask questions that you think might be dumb questions, because there's just so much that we don't know until we either experience it or have someone who we trust and can talk to make better decisions.
Awesome. And like DeVry and who was my other guy that, oh, I know it was he works for Futures Command. He's actually he just made Brigadier General, who's a
Nice.
lawyer, JAG Corps. Um, and you guys have a unique background, more so than others, right? Because I know, now that I'm an entrepreneur, sometimes I have people say, well, you're not really an entrepreneur because, you're retired, so you get a check. And I say, well, I just call that smart.
Right. Absolutely.
You know what I
Right. It's a
mean?
safety net.
Yeah. So it's like, okay, just because I'm not struggling doesn't mean I'm not an entrepreneur. I just, think by the grace of God, I've been blessed with, being really fortunate, being at the right place at the right time sometimes. But as a, coming through the military and then, going now, you're at a clinic. So talk about that life, that transition and why you decided to go to the military first and then afterwards what you decided to do.
Great. I joined the military, I think, because of my dad's service. So seeing him as a police officer instilled in me the desire to do some kind of service. My grandfather was in the military, but of course, not necessarily voluntarily. He was drafted for World War II. My dad spent time in the Marines. So the military was always an option that I thought was a very honorable profession. It wasn't until high school and actually being recruited by West Point that I knew anything about the military academies. I always thought that the Army Navy game was just a bunch of Army people playing a bunch of Navy people until I learned more. But once I found out that I could get my education and serve in the military, that's settled it for me. That was a way that I wanted to go. I also knew that there was a chance that I wouldn't be allowed to go to medical school right out of West Point. But I had the determination to say that, well, even if I don't get to go right to medical school, I'm going to still serve my time and then become a doctor. So that's how I started in the military, and I stayed for 25 years because it was a great career. It was a chance to travel around the world, to see a lot of different situations and help a lot of different people. And you often hear that the military is a meritocracy. And I will agree, in the first part of your career, it really is. There are certain things that you do to get promoted, to get to a certain level. But like any other thing in this world, once the number of slots, the number of available options start to diminish, then it no longer becomes a true meritocracy. Once there's a committee involved to decide who is going to go forward and who's not, then a lot of other factors play into effect. And I was fortunate to be able to stay in for the whole 25 years and leave as a colonel. Now, I left the military and transitioned to civilian care, taking care of people needing to find something similar. The military is socialized medicine. It's a place where anyone who needs help and care can get it. And I was spoiled. I really valued that system, to be able to take care of anyone and not worry about insurance. So I looked for a place that simulated that as closely as possible. And so I found People's Community Clinic. It's a FQHC, federally qualified health center, that takes care of uninsured, underinsured, the people who are more vulnerable because of lack of insurance. And in that population, I found the right place. I found people that I felt I could be the most value for and work with, giving my skills and talents.
Awesome. Awesome. There's some questions that I kind of lifted from Tim Ferriss that I kind of like, that he asked a lot of executives. And one of them is, what purchase of $100 or less has most positively impacted your life in the last 6 months to recent memory?
Less than $100, a good set of headphones, being able to listen to both music and podcasts with good quality headphones makes a big difference.
Absolutely. Here's another one that I really liked. If you had a gigantic billboard anywhere in the world, and you could get a message out to millions or billions of people, what would that message be?
My message would be that race is not biological, and that would be it. If I have to explain further, it's the fact that we have created this thought that the color of our skin reflects everything else on the inside of us, and it just does not.
And it's, being in the military, other countries aren't like this. Other countries don't identify their citizens by race, but we have a crazy history. I mean, any country where the race that overthrew the original inhabitants, and they're considered the natives, right? It's it's almost like the Twilight Zone. In the last 5 years or recent memory, what habit or behavior has, or belief, new belief, anything that's new, that most positively improved your life?
My family unfortunately went through significant health issues. My wife is a breast cancer survivor and a stem cell transplant recipient. And going through cancer in every family is really difficult. And those of us on the caregiver side have to take care of ourselves. So what I learned is that I had to exercise in the morning. So for me, exercise was my mental health strategy, to be able to get up early. A lot of times I was up when it was still dark to get to work, and getting that cardiovascular in just made such a big difference in helping me get through those many, many years. Thank God that she's well and everything is going well, but it's a habit that I've kept and try to keep, to keep my mental health where it should be.
How's she doing now?
She's great.
That's awesome. When you feel overwhelmed or unfocused, what do you do to get your focus back, or get back to center?
Yeah, I go into nature. I go outside and get some fresh air. I try to remind myself that I am just one part of a much bigger picture, and that helps to bring the focus back to whatever issue is causing distraction for me.
Awesome.
Oh, I also shared that after coming back from Iraq, one other way that I used to process all the things I had seen and been through was to make a video. I find therapy in putting those images to music and just creating something that puts all of those thoughts and feelings into a place that lets it out in a productive way.
What's one of the best or most worthwhile investments you've ever made?
People a lot of times talk about education as a good investment, but for me, education really feels like it was mandatory because of what I wanted to do. So I don't see that as an investment. That's a tough one. I think that investing here. Okay, so my best investment is the time I spend reading. I have spent a lot of time reading beyond medical text into behavioral economics, into science fiction. The time I invest in reading beyond the normal health and leadership things really helps to shape me and ground me and gives me new insight to things that I deal with.
Awesome. Oh, this is one of my favorites. What is an unusual habit or absurd thing you love?
that I do.
Yeah.
Hmm. It's not I play video games. That's not absurd. A lot of people do
Everything's
that.
relative too.
Right. Well, so maybe that's it. The amount of time that I can spend playing a video game is absurd. And I wouldn't say I love it. I want to change that. And sometimes I have to. Sometimes I have to delete stuff so that I'm not stuck playing something that I look up and 3 or 4 hours pass by.
That's good. You got to have something, right?
Mhm.
How has failure or a challenge or apparent failure set you up for later success?
So people who have not failed have not tried enough things. I really believe that. There have been times that I haven't got what I wanted. And I'll share something that takes me a long time to admit to people, but I'll say this publicly. The first time I took my pediatric boards, I didn't pass. So that was a failure. And it was very easy to wallow for a little bit, but then I had to change something. I had to do something differently or I'd get the same results. And so then I passed it the next time. But it was a reminder, and it's a lesson that I tell future students that and future doctors that you may not pass the first time, but that does not mean that you are a failure. So that is probably the lesson that is the closest to my heart. The fact that I didn't pass the test that validated me as a pediatrician when I took it the first time.
And I'm sure there's a lot of people who haven't, and it's like now they're these great doctors, but it's never how you start, man. I'm definitely a true testament to that. So what have you become better at saying no to over the last few years?
Oh, that's a great one. Retiring from the military, we were having a conversation about having that as a safety net. There is such freedom in knowing that even if everything else that pays you, everything else that makes money went away, you'd still be okay. So that gives you the freedom to say no to things. So for me, I guard my time a lot more. And I will say that on top of taking care of patients, I also work in diversity, equity, and inclusion. And to be able to say to an organization that is trying to just be performative and show that they want to talk the talk, but not walk the walk, and to say no to that is powerful. And I realized that I had to guard my time, guard my energy, because there's only so much of me. And I have decided to work with people who want to help themselves. I learned that really taking care of teenagers too, because when you see a young person, you can't make them do anything. The best you can do is help them understand what they're doing and then nudge them in the direction to make healthier, better choices. So once you understand that you can only control how you react and what you do, and you can give people information and guide them, it makes such a big difference. It takes the burden off your shoulders and puts you back into the role of guide. And I'd much rather be a guide for someone than doing the work for them.
I'm really digging this interview, man. I have a 14-year-old and I have a 14 and a 27-year-old, and we moved to Austin when I was, I took the command at the National Guard headquarters here, and so my oldest was 12, and so we have a pediatrician, and so with my youngest, we had the same pediatrician, but in my oldest, he struggled with weight. And I remember, Dr. D, she was, she kind of talked to him about weight management and all of a sudden she would like tell him exactly what he needed to do. Like, you should only eat meat the size of a card. And I think she told him to like, stop milk for like, like for 30 days or something. And my kid dropped 10 pounds and he just, of course he was going through puberty too. And so he shot up. And so he was just like, just absolutely, amazed at medicine, that stuff, that things can happen. And my little one, unfortunately, he's, my ex and I are you know, he's struggling. And so he's always like any little thing, he's like wanting to go to the doctor. And I'm like, dude, do you know these people have gone to school for like years and years? So talking to them about a little scratch on your finger. And so I would love, I don't know if you're taking new patients, but my kid is 14 and he needs to see a Black man, a strong Black man. So let me know.
Happy to.
Okay,
Yeah.
because I think it would help because unfortunately his dad is a techie and he's just, very different. And so, I try to make sure he gets as many positive male role models. I mean, he's seeing a therapist, and so he was a, Black male, and, just being able to see different versions, because in Austin, and especially professional Blacks, and so it's necessary. It's necessary to see all different types, and also to have somebody, because he'll say, well, Mom, you don't know. And let me tell you, he's got some stuff going on now that I'm like, bruh, can you not tell me? I mean,
you should be grateful that he's telling you that, though.
people tell me that, and I'm because I have this thing about Black males not being able to articulate and speak. So I was very strict with my boys about speaking, and now they talk too much, but yeah, I've had these conversations where it's like, you be careful what you ask for, because but yeah, I'm definitely, I mean, I really, just listening to you, I really think that just your whole vibe. I mean, he's, he needs you in his life. So
Happy to see him.
okay, awesome. We'll definitely we'll get on call your office and get on your calendar. Sorry about that.
That's okay.
Okay, so tell me, what do you see as your purpose in life?
I don't know if it's your internet or mine. You were a little shaky there.
Okay, now you're moving. Yeah. So let me, we're going to start that question over, and I'm going to see if I can change the internet connection and see if that helps. We only have a few more questions. Okay, it's still. Okay, let's see.
Okay, I can hear you.
Okay, let me see if I can get onto this network. See if that's better. Because right now I'm on my phone because chop suey. Yeah, it's still just I'm gonna try it again. Okay. Gosh, okay, I think I saw you pop back up. There you go. You pop back up. Oh, that's frustrating.
I switched I switched my networks too. Is that any better? My networks.
Okay, and sometimes if you stop, if I stop my video. I'm sorry, there you go. All right. Okay, so I see you moving now. Okay, so we're gonna, I can't remember what the last question. Oh, I know what it was. Was it? I wanted to know, what's your place, your purpose? Do we do that one? Can you hear me? You can't hear me. All right, I'm gonna